Hello and welcome. On behalf of California Department of Public Health, Office of Oral Health, we are so excited to share this step-by-step guide to using when sugar is not so sweet, a brief guide to explain how sugary drinks can harm your teeth. My name is Jessica Byers, and I am the Rethink Your Drink Coordinator for the California Department of Public Health, Office of Oral Health, and I will be facilitating this training for you all today. As a little bit of background before we get into the guide itself, I just wanted to say a quick piece on why this guide is needed. For one, as many of us know, sugar-sweetened beverages are the leading source of added sugar in children's diets. And we also know that sugar-sweetened beverages are subsequently linked to tooth decay. Specifically in California, 2 out of 5, or about 42% of children, consume at least one sugar-sweetened beverage per day. So day after day, week after week, and even year after year, this added sugar can really add up and cause many issues. Here we are talking specifically about oral health, although we all know that there are also other known health risks associated with drinking sugar-sweetened beverages. We were originally introduced to this guide from the state of Alaska's Department of Public Health and Human Services. It was developed through a grant that they received that was issued by the CDC. We found it to be very well developed and a great proven intervention to use in the dental setting to help reduce and eliminate sugar-sweetened beverages. The California Department of Public Health, Office of Oral Health, was granted permission from Alaska to both adapt and adopt the guide, or intervention, as it can be used interchangeably as it pertains to California. And I'm happy to announce today that we did just that, and that is what we will be going over to get you all familiar with the guide and to be able to take off running with it. Put simply, it is a simple guide that can be used by dental providers and other oral health educators to talk to their patients, families, and children about reducing and eliminating sugar-sweetened beverages in their diets to protect their oral health. Here is a quick overview of what the training will consist of. We will talk about using the 5 A's. If you're not sure what I'm talking about, no worries, you soon will. We will then talk about the power of motivational interviewing, as this guide is based upon motivational interviewing techniques, and then get into the nuts and bolts of the intervention itself, how it's laid out, and how to use it effectively and efficiently. And here are the 5 A's: ask, advise, assess, assist, and arrange. This guide uses the motivational interviewing method, a technique that has been shown proven results in helping people make positive behavioral change for tobacco and alcohol cessation, as well as obesity prevention, and is now being carried over to reduce sugar-sweetened beverages. The 5 A's is a motivational conversation technique that is also recommended by the American Academy of Pediatrics, so it lends itself very well to the purpose of this guide. Motivational interviewing allows the patients to voice their concerns and ideas for behavioral change, rather than having the provider tell them what changes to make and why. The basic conversation technique follows the acronym OARS: O for open-ended questions, A for affirmations, R for reflective listening, and S for summary reflections. The goal is to help the patients determine a behavioral change that works for them to promote a healthy lifestyle. The child or parent determines what they want to focus on, and then the healthcare provider, or the dentist, or hygienist, or health educator uses reflective listening to guide them towards that change. To summarize the 5 A's, you first want to ask about sugary drinks. Next is to advise to reduce consumption of sugary drinks. Then assess readiness to making change, assist with developing a plan of action, and lastly, to arrange for follow-up and support. And now for the design of the guide. The guide has been designed so that after you're familiar with its layout, you can easily navigate the pages with the legend. The legend has a green box that will be instructions for the page, a purple box with key messages, a blue box that will contain example responses, and a yellow box that contains tips. All of these color-coded elements will be helpful as you navigate the guide. The instruction portion that will be in the green shaded boxes will provide you with the purpose of the page as well as general instructions for the page. These instructions should not be read aloud. Again, they are just meant for your reference. Next, we have the purple boxes that contain key messages that should be shared out loud to the patient. They are not, however, intended to be read word for word. To make it even easier for you, there are portions that appear in larger bolded font that are the most important messages that you want to share about the page. There are also examples of different conversation styles that can be used so that you can pick the one that works best for you and your patient. The blue boxes share example responses from a potential discussion with a patient. You will vary your response based on your professional judgment. You'll also see some bolded statements in the blue box. These are statements that are recommended to be out loud as you respond to the patient. The responses take into account ORs like we talked about earlier, and this will help you guide through the discussion. The tips portion will be in the yellow boxes, and these will provide you with background information as well as some frequently asked questions and some other explanations that may be helpful to you. You will also notice a progress bar in the lower right-hand corner of each page. This will provide you with a view of where you are at in the 5 A's progression. It will help you keep track of your progress, allow you to skip ahead or backwards easily as you have your discussion with your patient. Again, by following the guide, you will ask about sugary drinks, advise to reduce consumption of sugary drinks, assess readiness for making change, assist with developing a plan of action, and lastly, arranging for follow-up support. Throughout the guide, there will be a patient view as well as a provider view for each of the pages of the guide. The patient view will primarily be pictures and graphs with very few words. The provider view will be provided on the very next page. There will be a thumbnail picture in the upper left corner of the page that will allow you as a provider to remember what the patient is looking at as you guide the discussion. The instructions, messages, tips, and example responses that we discussed earlier in the overview of the legend will also be provided on the provider view page as appropriate in their color-coded boxes. Next, let's look at the first page of the guide a little more closely together. The patient will see a variety of drinks, both sugar-sweetened beverages and non-sugar sweetened beverages, as you can see on this slide. The instruction on the provider view tells you the purpose of the page, which in this case is to use the visuals of various beverages to start a discussion about what your patient drinks. The key message portion suggests to say something like, let's look at these images together. Tell me which of these drinks you have on a typical day. Then in the same key messages or the purple box, there is a list of other ways that you can ask the same question to begin the conversation with the patient depending on your conversation style. Next, there is a yellow tips box. This one says to ask the child first, then confirm with the caregiver. Another tip is that you can ask more about the amounts of the drinks or the timing of drinks. It also suggests that if needed, you can use brand names to help clarify the images. Next on the provider page, the green box will guide you to reflect back on what the patient's responses to confirm understanding and to ask about the pros and cons of drinks that they consume. The blue box offers some example responses such as, so your family drinks mostly water, fruit-flavored drinks, and milk every day. And then bold, it is recommended that you add, what do you think are good things and bad things about these drinks? Next, you will see another tip in yellow that tells you that by framing the question like you did, the patient will have a sense of being in charge, rather than just receiving advice, which is a great way to use motivational interviewing. And lastly, there is a summary provided for the page. Here you will want to summarize both the good and the bad responses that the patient may have given you. After you provide a summary, trying not to add any of your own examples in, you can then ask the patient, did I get that right? This shows that you are listening and being responsive to the conversation. And that's the end of the first page. Each page will have a similar layout, a patient view as well as a provider view to help guide the discussion and give you all the information that you might need. After you go through the guide, you'll start to get the hang of it and find out what works best for you and your audience. And here we get back to the first page of the guide. This is where the patient was asked what they drink, and this is what will really guide the rest of the discussion and what information is most pertinent to share with a specific patient throughout the guide. We will now go through the guide page by page so that you can get familiar with all the content of the guide. Let's go on to the next page. Now that the patient has told you what they drink, this is the page where you would advise the patient to cut back on sugary drinks that they indicated drinking. The images help describe the process of tooth decay when teeth are exposed to sugar and sugar-sweetened beverages. Here you can explain in simple terms why sugar-sweetened beverages are bad for your teeth. If a patient reports drinking few sugary drinks, that is great, and this gives a provider an opportunity to encourage them to continue to limit and eliminate sugar-sweetened beverages from their diet. Lastly, it's important on this page to ask if it's okay with them if you share a bit more information to help protect the teeth and overall health, so that you can continue the conversation and advance through the guide. Use these pictures to further improve the patient's knowledge and understanding of how sugary drinks can hurt their teeth. Here you can discuss that over time, sugary drinks can lead to tooth decay. Explain that it may be difficult to notice at first, but as you consume more sugar-sweetened beverages, the enamel starts to dissolve and there may be some changes to the teeth, such as brown or black areas. At times, untreated advanced decay cannot be fixed and the tooth may need to be removed altogether. Also, here it is important to emphasize the importance of taking care of baby teeth, as decay and other issues resulting from decay may interfere with many things, like eating, sleeping, speaking, learning. It can also be very expensive and can cause pain and can even ultimately change a child's smile. Not only can sugar-sweetened beverages cause harm to the teeth, but it's also important for the patient to understand that there are a number of additional serious health problems that can last throughout a child's lifetime, such as unhealthy weight gain, type 2 diabetes, and the increased risk of heart disease with high blood pressure and high cholesterol. Next, we move into the assessment portion of the guide. The readiness ruler can be used to assess the patient's interest in making a change and to switch to a healthier beverage. By asking them how ready they are to make a change, you can base your conversation on that. This is where you can use your professional judgment on which actions to guide the patients to take. You may decide you want to skip some of the subsequent pages if appropriate at this time. Now is the time to start to assist the patient by offering some educational resources that may open their eyes to how much sugar really is in some of these common beverages. Open the conversation by asking the patient to tell you which drink they think have the most added sugar. After you summarize their responses, you can reveal how much sugar really is in each beverage by turning to the next page. After giving them a moment to look at the sugar content of each of the beverages, ask them what they might notice. Ask them if there's anything that surprises them. For example, it may be surprising how much added sugars are in vitamin drinks and sports drinks. It is also important for them to see that water and milk do not have any added sugars and are the healthiest choices and also make a great substitute for some of the other drinks that have a lot of sugar. Finally, ask them, does any of the information bring up changes you'd like to make for you or your family? This is where you put them in charge to wanting to make the change, and this is what really drives the ultimate behavior change. This image can be used to increase the knowledge and understanding of the U.S. dietary guidelines so they can make a plan to choose healthier drinks. The images show that one sugary drink has enough sugar for the entire day. This pick a plan image will help the patient and their family choose a step in their plan to choose healthier drinks. You can ask them, do you see anything on the page that would be a way for you and your family that could make a change? Ask them to pick a change or two that they think will work for their family. Although these are not the only options, they are a good start and make the patient to think of some other ideas that may work for them and their family. If you have gone over this before with the patient, this is where you can ask how it's working for them, and then see if there's additional steps that they can make to continue their behavioral change of reducing and eliminating sugar-sweetened beverages from their diets. Finally, you want to offer support and affirm their ability to make a positive behavioral change towards reducing sugar-sweetened beverages in their diets. Here, it is important to set up follow-up appointments if appropriate, or add some notes into their records for future reference. Leave them with this last visual: to choose healthy drinks for healthy teeth by drinking water and low-fat milk.